My name is Caitlin Weaver. I graduated from Colorado State University Pueblo Accelerated Nursing Program. I'm from California originally, but I already had a bachelor's degree, and so I wanted to do an accelerated program. And I looked up programs in states I thought I could live in for 2 years and chose Colorado. My dad is a retired nurse as well, so I think that was probably my original inspiration. And then I also graduated from University of San Francisco and with a bachelor's in kinesiology. I actually started my original undergrad in nursing. And I mean, I'm totally honest about it. I flunked out in the first semester. It was just the prerequisites, but I didn't know how to study. And so I kind of always wanted redemption for that because I was forced to change my major. Um, so there was that. And then after college, I ended up teaching CPR at a certification place in Santa Cruz. And I kind of had the thought of like, well, why not me? If they can do that, then I certainly can as well. So it was more kind of that than anything. I also really liked the flexibility and obviously the pay, depending on where you're nursing. Um, so I think those were kind of the reasons that I chose it. I'd like to say that I like to help people as well, but I think that's super cliche, and that's not really how I got into it. So I graduated in 2008 with my original undergrad degree. And because I had a bachelor's already, I was able to do an accelerated nursing program. So this is usually like 3 or 4 semesters straight through versus 2 to 4 years of actual nursing school. So I knew that I really wanted to do the accelerated version. I didn't need to like do the whole college thing again. And so I just Googled accelerated nursing programs and really just narrowed it down based on like where I thought I could live for 2 years max, like which states, Colorado, Washington, I was in California, kind of similar type states. And then also narrowed it down based on the prerequisites as well. So things that I already had taken. So I didn't have to like go out of my way to take more classes. That's honestly how I decided on it. I'd been to Colorado before, but I'd never been to Pueblo, which is in southern Colorado, and I didn't really even know where it was, but I decided to take a chance. Yeah, all of it. To be totally honest. So going to a school out of state, financially, I did have to take a lot of student loans out. I was lucky that my parents were able to help me a little bit as well, especially with like accommodations, because as an accelerated nursing program student, you don't live on campus and you don't qualify for any of that like traditional student housing. So I had to find an apartment off campus to live in. And then obviously food and whatnot. And I wasn't working. I do know people that did work through the program, but not being from the area and only being there for 15 months, it didn't really make sense for me to get a job. Um, and then, yeah, I'm out of state and I don't really know anybody and life goes on. And so missing events and things back home was really, really hard for a while. But I was able to take a couple trips during nursing school, actually in my last semester or second to last semester. Um, well, I told them I had a family emergency, but I actually did go to EDC. So I managed to get a little bit of fun in as well. But for the most part, it's really challenging. Yeah, to be away from your friends and family and to not have any money. I guess a couple things. Nursing school itself, all the programs are different. And so there's like set standard curriculum, but then it differs based on the school. So that was kind of interesting. Applying to one school versus another school had different, like prerequisites, and it had different, I don't know, classes and whatnot. But being a nurse specifically, I think like the biggest misconception is that other people have about nursing is that all nurses work in hospitals and all nurses have to do what's called bedside nursing. So working in a hospital with like 3 or 4 patients, and that's the gold standard for nursing. I don't work in a hospital. I work in a clinic. I work in a dialysis unit. It's outpatient. There's a lot of other jobs for nurses that don't have to be hospitals, but in nursing school, especially, you get a lot of pressure from your professors and like through clinical rotations to choose a field that is in a hospital. And so it was actually really hard for me not wanting to work in a hospital to then graduate from nursing school and like just kind of go out on my own, if you will, and find a job that matched what I wanted to do. And I still, to this day, people always tell me, oh, you could get a real job now. And I'm like, I have a real job. It's just not in a hospital. So I think that's a huge misconception people have about nursing. So a lot of people were CNAs or other type of like medical assisting before they went into nursing. And that probably was really beneficial and helpful for them. But I actually didn't. I haven't ever done any internships or volunteer work in the field specifically. I mean, I think my job teaching CPR to healthcare providers did help me in some way. I mean, at least on the CPR side of thing. But I actually didn't do anything in preparation. And I think I was fine. I mean, I learned on the go. I didn't have like that back knowledge that other students had, but I think you can do it either way. Okay, so once you finish nursing school and you graduate, your school essentially sends a notification to the national board. And they then send you an email saying, hey, you're eligible to sit on the national board exam. For nursing, it's called the NCLEX, and I don't actually honestly know what it stands for. But it is a national exam. So if you take it in one state, it's good in all states, which is really nice. But you have to wait to get this email to sign up for the test. And then it's just kind of a matter of like, when do you want to take the test? You've just graduated nursing school. All the information is still in your brain. So in my mind, I wanted to take it sooner rather than later, but not too soon. I wanted to still have some study time. So I scheduled it for maybe like 6 weeks or about 2 months out. And then for my day-to-day for that, I mean, I was still looking for jobs at this point because you can get hired on as a non-licensed nurse with then the expectation of you getting licensed. So I was looking for jobs full-time as well. But essentially, I would just like wake up, go to the library, study for a few hours. I had pretty extensive notes from nursing school, and so I used those to study for the NCLEX, and just like break it down by topic, and make sure I kind of covered all of the material. But all of the material is like the entire human body and how it works. And so that's a lot. There's also, what was also really helpful was they make apps that have like little test questions and whatnot. And so in my free time, I was always doing test questions and then practice tests as well, because the NCLEX is kind of a specialized test. So it's not only knowing the material, but it's how to test and how to answer the questions that's important. So you really have to be on top of it, like self-starter. You got to be in charge of your own life. So besides the misconception of like we all have to work in hospitals and that's kind of like the gold standard for nursing, I would say that nurses know everything, is another kind of misconception. I say that, like, yeah, we do go to nursing school and you are taught everything. But then once you get a job, you usually specialize in a field, whether that be like I'm in dialysis, or you work in the ICU with critical care patients, or maybe you do oncology, which is cancer, or you have stroke patients. Like, a lot of times you end up specializing. And so then people will ask you questions that aren't in your scope. And I always kind of pause a little bit. Like, I no longer can tell you about your rashes because I don't see rashes in my day-to-day life, but it kind of makes me feel a little bit uncomfortable because I think people expect that I'm going to know everything and remember every single detail I've ever been taught. I don't know. I kind of looked at this question and I honestly wasn't sure. I think that people would be surprised that it's not the same every day. So I have chronic dialysis patients. These are end-stage kidney disease patients, meaning their kidneys no longer work, and your kidneys filter blood and clean out toxins out of your body. So my patients have to come into the clinic 3 days a week for 4 hours in order to just sustain normal life. So I think people are usually really surprised by that type of commitment, that I have enough people that are committed to staying alive and relatively healthy to actually commit to that type of time schedule. If they miss a dialysis session, it can really affect them. It can kill them. They can end up in the hospital. And so I think for me specifically, working in dialysis, I think people are really kind of like, wow, that's insane that that's what dialysis life is like. And then another one was that not every day is the same. Just because I'm seeing the same patients on the same time schedule, things can go wrong even with like people you would consider, otherwise healthy. So every day is not the same. It's not actually a boring profession. There's, blood spills, there's people that have seizures, there's other medical emergencies that we have to deal with. So every day ends up being a little bit different, which is nice. Right now, like I said, so the gold standard is hospital nursing. I would really I don't know that this is like specifically where nursing will go. I can't really predict that, but I would really like for specialties to be kind of given more of a spotlight than just hospital, first of all, and that nurses get paid more for the grief or whatever that they endure. Because to be honest, nursing is great, but patients aren't always kind. It's probably the worst day of their life when you're seeing them. And, you don't usually have the best news for them, that this is going to be their life for the foreseeable future. And so they're unhappy, and I get that, but they act out against you because you're there. And so because of that, it puts nurses in danger a lot. So to combative patients, I've had to call the police for patients that I didn't feel comfortable dealing with. I've been bit, kicked, punched. I really would like to see nurses be better protected by their employer and be able to press charges against patients who physically abuse you, because right now that is not the case. That is just something that's expected, that, hey, you know what, people are going to act out against you and you're going to be their punching bag and there's nothing you can do about it. So I really hope that, I know there's people on the internet that are speaking out against kind of the abuses that nurses take. And so I really hope that that goes somewhere, because otherwise we're not going to have any nurses. Nobody wants, that for their job. And then we'll end up in another nursing shortage. So that's what I'm hoping, but I don't know, if that'll come true.